Welcome back to Healthwise. With us is Dr. Holly Provost, OBGYN, and we were talking earlier about her being an OBGYN and using Leonardo, which is the new robot that they gotten at Opelousas General Health Systems. And is the robot just at Opelousas General? I mean, it's stationary there?
Yes, the hospital bought it a few months ago, and it's specifically for the hospital. It doesn't travel to any others. It's not shared. Like the lithotripsy or anything like that, no, this is mainly for the hospital.
Okay. And as I was saying, we got to play with it a little bit because they had it set up in the lobby, and anyone, I mean, could come up and the guy would work with it and he would have it doing all kind of little things. We got to pick up a nickel and a paper clip and all these other really, really fine things that actually it was easier picking it up with the robot than it was with and I see they have some pictures of it on the screen, but you can kind of tell us a little bit about what we're seeing.
What you're seeing in the foreground is the physician who's sitting at the module, and you see his fingers are in loops and he's using it. And across the way now is the patient laying there with the robot inserted through the trocars. Now the trocars are what we use every day for laparoscopic surgery, and you can put your instruments in there, and that's doing a prostatectomy, I think, there. But we're able to do more fine precision work. They're reanastomosing everything, but we could see the nerves better, and that's with prostate surgery, worry about nerve damage. This is the robot being installed, the patient is asleep, and you put your trocars in your sleeves that allow the instruments to go in, and that's just hooking everything up, and that's the camera.
And the trocars are the arms, that's the
trocars are the sleeves.
The sleeves, okay.
And so once the sleeves are in and all the instruments in, the surgeon goes and sits at a console. And from there, we're able to use those instruments that are already in the patient to be able to do our surgery. Now this is what Reggie was talking about by using the grape and peeling the grape and with the nickels. This just shows the fine precision work that can be done with this. Now the ends of the instruments are able to move better than our wrists, so I can pick up and move things around and get to different locations that are more difficult, especially when I'm just doing straight laparoscopic surgery. But you see all the delicate work you can do by peeling the grape and peeling the skin off the grape without any damage to the meat inside.
Wow.
Yeah, it works that well. This is just one of the skills labs we use whenever we're learning how to use the robot. It's just to get your precision going and get your hand-eye coordination so you can move the rings around and just learn how to use the instruments. And they're not showing a lot of movement with the ends of the instruments, but really it's an extension of the surgeon, and you can move things around. You see how that flipped over? That's what we use during cases. And this is magnified with the robot at 10 times its magnification. So what we're using here is a needle that's very small, but it looks large, and that incision they're sewing is small as well. But you can see the surgeon's hand at the bottom. We put our hands in those little loops, and the console that's being set, and it's always within view. The patient is always in view of the surgeon.
Wow, that was better than what I saw. When we messed with the robot at the hospital, and I didn't know it could do something that fine like peeling a grape. They didn't have a grape there. They had things like nickels, paper clips, and stuff like that. But that was really, really interesting that they could just peel that grape without
without any damage to underneath.
And I guess on the ends of the trocars or the ends of the
instruments,
you can change out the different, I guess, tools that you would need, like a scalpel or a needle and all that stuff like that.
We use a lot of cautery, and so there's scissors with cautery attached. So we can coag things and burn. But so I have a grasper on one side and scissor on the other, and I'm able to dissect and do what I need and spread things out and find things better and see it better. So any adhesions or scarring, I'm able to see it better and then prevent damage to the vital tissue.
I even I noticed too that as far as the wrist movement and like you said, you can move this a lot more ways than you can actually move your hands.
Yes.
I saw it spin all the way around, almost 360, which you can't do that.
But it's not just spinning in one plane, it's spinning it all. So I can put my instrument high and bend the tips down or pick them up and do like that and get around a corner and look and hold it better.
Right. And I noticed even the magnification you know, he showed us how, you know, it could really magnify. It can even go like as far as 3-dimension or versus 2-dimension.
Right.
You know,
it's 3D and then it's HD and it's all very clear. And I can move my instrument to get right on whatever structure I'm looking at. If I do it laparoscopically, I can put my camera there, but it's not 3-dimensional. And if I do it as an open case, I can't get as close. I can't see what I need. I can feel and I can assume that whatever's okay, but with this, I can get on it and I can see it clear.
Wow. So I noticed, you know, the doctor is not right there. He's sitting like over to the side. So actually your nurses and all those are the ones that's doing like if you have to do any irrigation or anything like that, they're still there to do that. But the doctor's actually sitting off to, I mean, that's just amazing. Can that be used like, I guess, do you have to be in the same room or you know?
I mean, in theory, whenever it first came out 5-6 years ago, that was just the Star Trek thinking that the physician doesn't even have to be in the city, not even in the state. If there's some difficult procedures, then a physician can use it elsewhere. But that's just not how it's used. It should be in the room, and that's how we line it up, that I'm at my consult, I can see my patient, so I can get there within a second in case something is needed, in case something is not quite right. And then it's just more, it's safer that way.
Okay, great. Well, Doc, we're going to talk a little bit more about that after we stop for this brief break for our sponsors. We got to pay the bills.